Hyperemesis gravidarum is a severely underappreciated condition which can lead to suicidal idealization and PTSD. HG is currently the primary reason for the termination of wanted pregnancies. Sadly, there is a huge lack of affordable, specialised mental health support for those affected, leaving vulnerable women suffering emotionally and unable to access understanding professional counselling. Thanks to funding from the Big Give Women and Girls campaign and our incredible supporters who back in March helped to fund the project, we are now ready to launch our HG specialist counselling service. The new counselling service will bring accessible, condition-specific support to sufferers through HG specialised counselling via telephone and Zoom sessions. We are thrilled to announce that there will be a large number of fully funded and heavily subsidised counselling sessions to ensure that this new service is accessible to all demographics, including vulnerable and disadvantaged women. Alongside this, we are also creating a HG mental health hub, where we are bringing together HG-friendly mental health professionals to provide helpful resources and improve services and referrals around the UK. Today, I am joined by clinical psychologist and HG sufferer, Rosie. Rosie, thank you so much for joining me today. How are you doing?
I'm good, thank you. Thank you so much for having me. I really appreciate being able to talk about this because I think that HG and severe sickness just isn't spoken about enough.
So, Rosie, can you start me off by telling me a little bit about your professional role as a clinical psychologist, please?
Yeah, absolutely. So as you mentioned, I'm a clinical psychologist and I specialise in mental health in pregnancy, birth and the postnatal period. And basically that means that I help people who are struggling with anxiety, feeling low, or the after effects of traumatic experiences. And something that I've really noticed over the last 5 years since I set up my social enterprise is that people are getting much, much better at asking for help after the baby is born. So we're seeing a lot of people now coming forward, recognising that they're struggling with postnatal depression, postnatal anxiety, and people are really talking a lot more about birth trauma as well, which I think is amazing. And I'm so pleased that that awareness is coming through. But what I'm not seeing is people coming forward for support during pregnancy. And that seems crazy to me because pregnancy is one of the most difficult things I've ever been through. You mentioned I suffered with HG or severe sickness. I prefer to call it severe sickness because people get really hung up on whether they meet diagnostic criteria for HG. And one of the key things I wish people knew about mental health in pregnancy in general is that you matter and you deserve support, whether or not you've got, X, Y, and Z to meet the diagnostic criteria. I don't care about that. If you're struggling, you matter, you deserve support. So that's why you probably hear me talk a bit more about severe sickness than I do about HG generally. But yes, it seemed crazy to me, having been through such a difficult time with pregnancy, that I just wasn't seeing clients coming forward with struggles in pregnancy. And the more I dug into it and the more I went and met with other women who'd been through severe sickness, the more I realised that people just had no understanding that there was help and support available to them. Everybody was sitting in their houses thinking there was something wrong with them or about them as a parent, that meant that pregnancy wasn't filled with joy for them, like it was for everybody else. And we need to break down that stigma and those beliefs. So that's kind of why I'm doing what I'm doing with my Instagram, The Pregnancy Psychologist, and why I'm so chuffed that you invited me to come and talk to you today.
Well, we're thrilled to have you. Thank you, Rosie. So you were unfortunate enough to experience extreme pregnancy sickness. Can you tell me a little bit about your experience, please, Rosie?
Yeah, I mean, wow, where to begin? So I was really excited to get pregnant with my first baby. I think I need to say that I've got 3 now, but actually we struggled to conceive with my first. And so when it happened, we were absolutely over the moon, delighted. But I think it was only about 4 days after I got the positive pregnancy test when the sickness hit me. And it was just like all of the joy and all of the colour drained out of my life instantly. I didn't have any appreciation before that moment that it was possible to feel that terrible. And I lost everything that I cared about in, the space of a couple of days, really. So I was an NHS psychologist at the time, and I loved that work. I mean, if anybody from my old life in the NHS is watching, I could not have loved the role that I was in at that time anymore. But it had a long commute attached to it. So I was commuting from one side of London over to the other, about an hour and a half each way on the tube. And very, very quickly, within, a few days of that pregnancy test, I was completely unable to get into work. So I think I limped in a few times. I had an amazing manager, really lovely supervisor. And they both just looked at me. I'd been sick about 9 times on the way in and dispatched me home. And they really tried to take care of me during that period. But for me, so much of what gave my life meaning, what gave me a sense of worth as an individual, was about my work and about helping my clients. And I couldn't do any of it anymore. I lost my social life. I couldn't look at my phone. I think that's common for people struggling with severe sickness. But again, I don't hear it spoken about very much, that often the resources that are available, you've got to be able to scroll on the internet to look for them. I couldn't scroll. I couldn't pick up my phone to call my mum. I couldn't do anything really. I had to just kind of lie flat most of the time to get through the day. So I lost all my social contacts. It started to impact on my relationship with my partner, because he wasn't used to seeing me in that way. I'm not typically somebody that goes to bed when I'm poorly, but this was like, impossible to walk and be around in the world through. So I was behaving in a way that he wasn't used to. He didn't know how to help. He'd never heard of pregnancy sickness being like this. Both of our mums had sort of normal morning sickness. I hate that term, but it was episodic. So it came and it went. It came in waves. They were able to function through it. And so that's what we expected for me. And it just did not match my experience whatsoever. I mean, on top of that, when I did reach out to help, I managed to get myself down to the GP. I was just met with a lot of skepticism and a lot of, oh, try ginger. I had to fight and be really confident in myself to get them to give me medication to start with, because they were really on the fence about whether they should or not. I knew I wasn't keeping water down. And anybody watching this who's been in that position, you feel terrible after just a couple of days of that, like terrible. And I knew enough about the human body to know that was a big problem. So I was willing to try medication quite early on, but my GP was really unwilling to prescribe it. So again, that felt really challenging. And I wouldn't, I worked in the NHS and I've got doctor before my name. Although I'm not a medical doctor or clinical psychologist, but, I had all those things working in my favour, giving me that boost of confidence, and I still found it virtually impossible. Dealing with all of that, dealing with that change in the way that people saw me. I was used to people seeing me as very competent, as a helpful person, and suddenly I'm the person being sick on the tube, being picked up. I was literally rescued by a vicar. On the tube, I'd been sick so many times I couldn't stand up to get off the tube, and he literally picked me up by the arms. He gave me water, he gave me tissues, and just looked after me while everybody else looked at me like I was, a disgraceful drunk passing out on the platform. So basically, I suppose the upshot is it was the worst time ever. I experienced a lot of judgment from other people. I was judging myself very harshly, and I'd lost everything that gives life meaning. And what does that add up to? Well, that adds up to depression. It would be impossible to go through those things and not feel depressed, which is why if you're suffering with severe sickness, I think it should be automatic that you get psychological support, because you would have to be made of stone not to feel depressed and full of despair if you go through any one of those, let alone all of it. And most women I've spoken to struggling with severe sickness, they are facing all of those experiences that I just talked about. So for me, I was feeling extremely low and also a bit traumatized. because I had no understanding before that it was possible to feel that way. So it kind of shattered my worldview of what life could be like. And, I'm kind of laughing about it now, but when you're in the throes of it, especially in your first pregnancy, you can't see that it's going to end. I think that's something a lot of people, a lot of my clients have spoken to me about, that it feels like this may just be my life now. I might have to live like this forever. And I think, sadly, a lot of the time, that's when the thoughts of termination start to come in, because you start to think, I can't do this for this period of time. I can't do this forever. Of course, nobody could do it forever. And so I think it's really understandable to have those thoughts. I had those thoughts and they really frightened me. And again, that adds to the shame that you feel and leads a lot of people to start thinking there's something wrong with them, when in fact, that's a really rational thought to be having when you're feeling that way. Thankfully, that is where my experience as a psychologist really helped, because although I didn't work with pregnancy prior to this experience, I knew from the work that I'd done previously that often we have thoughts which they don't mean anything about us. They're just sort of mental products that our mind produces under stress, that don't necessarily mean anything about what we're going to do or who we are as people. So I already knew that. So I was able to hold those thoughts quite lightly, take a deep breath, take some space from them. And they didn't cause me the level of anxiety I see in some of my clients, but they weren't pleasant. It was still really horrible to be thinking that way about a pregnancy I'd wanted so badly before I got pregnant. So that was my story with my first. The sickness never really left me in that first pregnancy. So I was still being sick right the way up to delivery. In fact, I was sick during labour. And I remember feeling really shortchanged about that because I didn't really have any period where I was able to enjoy that pregnancy. And everybody kept saying, oh, the second trimester will be, lovely, you'll be glowing, all the rest of it. That never happened for me. So it was just a whole pregnancy of misery. And then for me, and I know this isn't everybody's experience, but once the baby was born, literally as I pushed her out, the sickness lifted. And that was possibly the most exhilarating moment of my life. I can't even put into words how wonderful it felt when the nausea lifted, but I know that doesn't happen for everybody. The pregnancy number 2 actually followed quite shortly afterwards. Because we'd had struggles conceiving my first, we didn't really expect that it would be quick to get pregnant again, but it was. So I found myself pregnant again with a 9-month-old to look after, and my husband, who's in the forces, was overseas, which nobody would have really wanted that timing, but that's what happened. And again, I was really pleased to be pregnant, but this time I knew what was coming and I took action to try and help myself. So the first thing that I did was I made sure that I wasn't in a role where I was going to have to commute a really long way. So I took a job that was much closer to home. I was still at the end of my maternity leave from my first pregnancy, so I was able to kind of shift those dates around a bit and not return to work until the second trimester. And I was able to switch my job to somewhere that was much closer. The other thing that I did was I made sure that I didn't plan to do anything at all in the first trimester. So whenever my daughter was sleeping, I was able to sleep. And thankfully, my daughter was an amazing napper at this period of her life. So that meant that during the day, I was actually able to get 4 hours of sleep, and I slept all the way through the nights as well. So I was able to kind of schedule in to get a lot more rest. The other thing that I did was I signed myself up with a mindfulness teacher, because a little bird had kind of whispered in my ear that mindfulness could be really helpful for severe sickness. And I didn't get that message during my first pregnancy, but I heard about it kind of in between the two. And I knew as soon as I got pregnant the second time that was something I really wanted to invest in and try for myself, because I had tried everything else in the first pregnancy. Anything you can think of, I did it. and none of it made an iota of difference to me. But mindfulness, I'd used it in my past life. As a psychologist, it's something I'd been trained in. And I'd found it extremely helpful for managing stuff like stress, bereavement, difficult stuff going on at work. It had not occurred to me to use it during that first pregnancy. I think it often doesn't, because we're going through so much and we're in such a difficult position that unless somebody directly says to us, try this, we tend to not think very creatively. So I hadn't tried it during the first pregnancy. I was determined to do it during the second one. So I think it was probably week 7. Yeah, the week after the sickness started, I started my formal mindfulness training course. And it basically involved this lovely lady called Mary speaking to me for about 2 hours on the phone every Wednesday, I think it was, and leading me through these long mindfulness practices, which I would then take away the recordings of and practice, every night religiously. And that took me through into the second trimester. I think it was like a 12-week program. And it made such a colossal difference to me. I mean, it's possible that I would have felt slightly less sick in the second pregnancy anyway. I don't know. But what I do know is that in that pregnancy, and then in my third pregnancy as well, I was much more able to function. So I was able to take care of my daughter. I was able to do things like get in the car and do a Tesco shop. I didn't.
Wow, that's huge. Yeah, that's huge.
I know, that is huge, yeah. Right? Like, compared to the functioning I had in my first pregnancy, being able to do those basic domestic care activities for myself, I could even, and this will amaze you, I could even feed my daughter that manky, mushed up food that they have at 9 months. I didn't enjoy it, felt rubbish, but I did it.
Yeah.
And that, I mean, to anybody watching this who is feeling like I did with my first pregnancy, that was just a revelation. The fact that I could still do the stuff that made me and that mattered. And at that time, that was caring for my daughter. And also, I think I was doing a little bit of reading. For any psychologists who might happen to be watching this, you'll know we love and really value reading up about the latest stuff that's going on in the world of psychology. So whether that's, mindfulness and pregnancy mental health or birth trauma or something like that, being able to just read every now and again and have that connection to my work, which matters so much to me, that really made a difference to my mental health. I was also able to chat. I had a couple of good friends who would come over and I could do a bit of chatting. Now, I'm not saying I wasn't able to do a lot of socializing. I wasn't going out to coffee shops. But if people could come to me, I could talk to them. And again, that made such a huge difference to my mental health. And I think that probably contributed as well to the sickness being slightly less. So we're going to talk a bit later, I think, about how mindfulness can have an impact on how we feel physically. And I certainly felt that impact for me in the second and third pregnancies. I mean, by the time I got to my third pregnancy, I was doing things like the nursery run, taking my two kids then to preschool. And if I can do that, I think anybody who's done a nursery run knows how challenging that can be. The fact that I could do that, I really credit mindfulness with that. So yeah, pregnancy 2 and 3 were a lot easier for me, but I'm not saying they were easy.
So, Rosie, you sort of touched on it, but can we just sort of delve in a bit deeper about how HG can affect your mental health?
Yes, I mean, there are so many ways that it would be impossible to cover them all, I think, and we're all individuals, so we all have different experiences. But, the first thing that I think probably applies to almost everybody with severe sickness is depression. So HG strips away your ability to do a lot of the things that bring life meaning. And what we know is that for good mental health, we have to have a balance in our lives of things which bring us pleasure and things which bring us meaning. And sometimes the things that bring us meaning are actually more important than the things that bring us pleasure. So, often in life, we might go through periods where we don't have very much time to do stuff which is just pleasurable, like, going to the cinema or watching something on Netflix. But if we've got stuff in our lives which feels meaningful to us, that gives us a sense of identity and purpose, and that what we're doing matters in the world, whether that's caring for our children, something we do in our careers, being a good friend, being a good partner, all of that stuff which makes up who we fundamentally are as people, if we don't have enough of that, we get depressed. And HG, or severe sickness, often takes that away from us in one fell swoop. So that is the first way I think people might notice severe sickness impacting on their mental health. But what also tends to happen during pregnancy in general is that our threat system tends to be activated. And that's because pregnancy in general is a time where we have less control over what's happening in our bodies. We've got less control over what's happening in our lives, what's going to happen in our lives when we become parents for the first time. And so we often feel quite anxious about that, and we start to have intrusive thoughts. Often I think there's a study that shows that almost all parents struggle with these dark thoughts that intrude on our consciousness, where we start to worry, are we an unfit parent? Might harm come to the baby? We start to have these thoughts and worries about the baby, about ourselves, that we struggle to shake off. And that's a very common experience in pregnancy. It's actually totally normal, and it can give us the energy that we need and the vigilance that we need to create a new life, which helps us to look after a vulnerable little baby. So it serves an adaptive function. But very often in pregnancy, it can get a bit out of control, and that threat system can start to dominate us, and those worries start to dictate what we do in our lives. And that's when we can stop doing the stuff in life which gives us that sense of meaning and pleasure, which can lead us to feeling low and to the anxiety getting stronger and stronger. Now, as you might have already guessed, an experience like HG, where we've got all these horrible physical symptoms going on, is quite likely to send our threat system into overdrive, because we've got a whole new set of things to worry about. We've got even less control over our bodies than we normally do during pregnancy. And we might start to worry about our health. We start to worry about the baby's health. We start to worry about whether we've caused it, whether it might impact on our future relationship with our baby, whether it means that we're a bad parent. There are all of these worries that come along with HG that come on top of those normal worries that come up for a lot of us during pregnancy. And that makes the threat response even stronger. So it's like this vicious cycle where we get a bit of threat response. That makes our brain start thinking in a certain way, which gives us things that we worry about. Then we get the HG giving us more things to worry about, which fuels the threat response, gets even stronger, and we end up in this cycle, which is very, very difficult to break. So in that way, anxiety plays a big part as well. But there's also a lot of trauma involved with HG. And I would say that I experienced trauma, even though compared to a lot of people, my experience of HG was on the milder side. So I did not end up in hospital for long periods of time with my HG. I was very lucky. I think my body kind of clung on. I lost a bit of weight, but my body clung on to what it needed, which is just luck, I think. Some people end up going through really invasive procedures in hospital to try and keep them alive and sustain them and their baby. And those invasive procedures can trigger a lot of trauma in the body and in the mind. It's very difficult sometimes for us to make sense of those processes, particularly when we might be a bit out of it when those things are happening to us. So for that reason, the experience of being cared for and the treatment for HG can be very traumatic for people and can lead to those typical PTSD symptoms that you might think of when people have been through a car accident or something similar. So you might find yourself experiencing flashbacks, you might experience nightmares, you might notice, symptoms in your body like shaking, feeling on edge all the time, finding it really difficult to go back into settings which remind you of those experiences. You might find yourself avoiding going to the GP or to appointments, finding it very difficult, maybe even to go for your antenatal appointments or visit the delivery suite, because all of that stuff reminds you of those invasive treatments. So there's that kind of trauma, but there's also the trauma of just the shock of feeling like that. The shock that something like this can happen to you as an otherwise healthy person. And there's the fact that a lot of people will fear for their lives at some point with HG. As I said, my experiences were on the milder end of the spectrum, but when I realised I hadn't kept any water down for weeks, I started to worry that I wasn't going to make it. And I worried a lot about my baby. When I noticed I was losing weight, I had all kinds of thoughts about what that would mean for the baby. I need a lot of reassurance about that. And those thoughts in themselves are traumatic. And you can notice some of those symptoms that come along with PTSD after your HG has resolved. And I think one thing I want to say about trauma is if you're one of those people who very unfortunately suffered at the sharp end and needed all of those invasive treatments and maybe had tube feeding and those kinds of treatments, it's likely that somebody spoke to you, or I hope to God, somebody spoke to you about PTSD and trauma. But very often it's trauma with a little t that causes us enduring problems, and people often don't know to seek help with that. What I would say is don't judge your trauma. If you're feeling like you relate to any of those symptoms I just spoke about, then you are probably struggling with trauma, and psychological therapy could help you to move past it. So don't try and judge your trauma and decide whether it's bad enough. If you relate to any of those symptoms, even if you were like me and at the kind of milder end of HG, get some help, because psychological therapy can shift this trauma really quickly. So it just pains me that people might suffer in silence.
And Rosie, that trauma won't resolve itself on its own, will it? If you just carry on with the attitude I hear a lot of people say, like, oh, it's okay, I'm busy, I've got little ones, I'll just muddle through. That isn't going to do you any help in the long run, is it?
No, I think especially if it's been more than 30 days since your traumatic experience, and you're still noticing stuff like flashbacks, strong sensations in the body, like you can't relax, you're feeling on edge. If you're noticing anything like that and it's been more than 30 days, the chances are you are going to need a little bit of help just to get that processing going. The sooner you come for help, the quicker that processing is likely to go. Okay. So it's well worth getting help early with that if you possibly can. That said, the treatment that we offer for trauma, it is just stimulating the natural process that the brain uses to process trauma. But often there's something that gets it stuck, and we need to unblock that for that processing to happen. So there's nothing kind of mystical about what we do in trauma therapy. We're just kind of helping the brain to do what it should have done with those memories in the first place, but it often doesn't because something else happens that gets in the way. So typically, with a HG experience, you've got a lot going on. So you have a traumatic experience, but you don't have time to process it because you've got a baby to worry about, or there's another health concern that comes on top of it, and you have to kind of switch into worrying about that. So there isn't time for that natural process, that healing process to happen. So we might need to do a bit of work to unblock it so that your natural process can happen. And so it's not this kind of mystical, fearful thing. It's a natural process, but we might need to do a bit of work to stimulate that. Does that make sense?
Yes, it does. So the processing of the trauma, that is a separate issue to what we're going to talk about now, which is the mindfulness. Is that correct?
Yes. Yeah. So we tend to process trauma, we tend to use therapies like trauma-focused CBT or EMDR, which is eye movement desensitization and reprocessing, which is a very fancy way of saying that we try and stimulate both sides of the brain to shift those memories to where they need to be in the memory, rather than floating around at the front of the mind, dropping into your life when you don't want them there. So that is a bit different, but We've got a lot of evidence-based therapies that really help with that trauma. So please don't, if you relate to any of those symptoms, don't hesitate to get help with it, because it's one of the quickest results that we see as therapists. So if you're struggling with it, please don't suffer in silence. But yeah, just a couple more ways that HG impacts on mental health, because I think these two often get forgotten about. And I promise I'll be quick.
No, Rosie, this is so interesting. Please take as much time as you need.
But I just wanted to say that, the experience of severe sickness, it often really impacts on the relationships with people around us. And those impacts can be long term. And as a new parent, you really need your relationships to be as strong and supportive as possible. And often a HG pregnancy means that we're actually going into parenthood already with a lot of strain on those key relationships in our lives, because it's scary for a partner to support you when you're struggling with this kind of sickness, and they may not react well. They won't react perfectly because, for goodness sake, they're not trained in how to react perfectly. So even with the best of intentions, they might do stuff which is a little bit unhelpful. And so you're kind of starting your relationship as parents on the back foot. And it's true of all the other important people in our lives as well. You might find that you didn't feel well supported by your friends. You didn't hear the things you needed to hear from your parents or your close family. And that's nobody's fault. This is a nightmare for everybody involved in the system. And so that can often have a bit of an impact on mental health as well, going into parenthood. Another thing which I see a lot is this sense of, who am I as a parent? And when you've struggled with something like severe sickness, often you can start that journey into parenthood already feeling inadequate and like you didn't do a good job of pregnancy. And those self-judgmental thoughts are a key component of postnatal depression. When people are really struggling with their mental health postnatally, those thoughts about, I should have done this differently, I am this type of person, I am a bad parent, are usually strong and at the forefront of people's minds. And HG can unfortunately really contribute to that being there from the very beginning of the parenting journey. So I would say, those are the main ways that HG impacts on mental health, but it's an individual thing. And I would have to spend years probably talking about it to get through all of them.
Well, shall we move on to mindfulness then? Can you tell me what is mindfulness, Rosie?
Yes, I think there's a lot of misconceptions about mindfulness. What mindfulness actually is the ability to play with our attention. It's the ability to focus a spotlight on certain things, or to bring up the lights and focus on everything at once, if we choose to do that. It's that ability to play with what we're paying attention to in the moment. Because if we can do that, then we can stop ourselves from being pulled into an imagined future where we imagine that everything's going to be terrible, or being pulled into all the busyness we've got in our lives, into our to-do list. And instead, we can be present in the present moment and focus on the here and now. So in that way, mindfulness can help us to be more engaged with our lives and to find a sense of peace within that present moment, which is, pretty attractive at the best of times, isn't it, when we live in such a hectic world. But it can really help us to do the things that bring us meaning in life, even when we're feeling rubbish, because we're able to put our attention on the stuff that we value, that we want to be doing, rather than always being hyper-focused on the unpleasantness of the nausea or, the intrusive, horrible thoughts we're having, whatever it is which is making our lives really difficult at the moment. If we have this skill of mindfulness, then we can choose to focus on the stuff that we care about instead. And it won't take away the horrible thoughts, it won't take away the nausea, but what it can do is allow us to function and do some stuff that matters to us alongside the nausea that we're feeling. And mindfulness can also actually activate our parasympathetic nervous system. And this is what you might hear termed the soothing system. This is the part of our nervous system that we require to rest, digest, for our immune systems to work properly, and also for us to kind of calm down if we're feeling panicky or anxious. It brings us a sense of peace and well-being in the body, and it actually helps the body to function better as well. So in a nutshell, that's what mindfulness is and what it can do for us. It does not have to be about meditating. There are lots of different ways to be mindful.
Well, I know if I think back to when I was suffering, Rosie, I would have tried anything to make myself feel better. So is it okay then if we go through a little example of the mindfulness practice now so that anybody watching at home can give it a go themselves?
Yeah, absolutely. I mean, just one thing to say actually for people who might be watching this and thinking, okay, so I understand how mindfulness can help with anxiety and low mood. Because it's kind of obvious, isn't it, that those struggles are fueled by the way that we think. So it makes sense that if we change our relationship to our thoughts and we're able to take our attention away from those really difficult thoughts and put it somewhere else, it makes sense that it would be helpful for mental health. But I also think it's important to recognize that mindfulness, when we get skilled at it, can have a direct impact on the body and on this part of our nervous system, which we call the threat system. And the threat system, if you think about when that's designed for when we're under extreme physical threats. And if you put yourself in that kind of a situation where, maybe you're fearing for your life, well, how does your tummy feel when you're fearing for your life? If you can you answer that for me, Faye?
It doesn't feel good, Rosie.
No.
Yeah.
No. So one of the things that happens when we feel under threat is that the blood gets diverted to our extremities to allow us to fight or to run away. And that means that the blood drains out of our digestive system. And the result of that and some hormonal changes that take place is that we feel sick. And often we will be sick under extreme pressure, or we might find ourselves running to the toilet. Now, if you're experiencing severe sickness and you're having lots of worrying thoughts about that sickness, and you're in that cycle that we talked about of the threat system kind of ramping up and up and up, to me, it seems very likely that that system is going to make you feel more sick, because it does under all situations. So I do believe, and this was certainly my experience, that by doing mindfulness regularly, we can stop ourselves from feeling more and more sick. We can stop it from snowballing in that way. Now, we don't have the evidence base that we need behind that yet, basically because it's very, very difficult to prove, but it makes strong theoretical sense to me. And it's also my lived experience and my experience with my clients that mindfulness can actually reduce the amount of sickness. It's not going to stop it, but it can stop it from snowballing. So if you are in that depth, that pit of HG where all you're doing all day is vomiting, please give this a try. Just see if it works for you, because it may just give you that little bit of space, that little bit of time to breathe, and maybe get a little bit of water in, that can make all the difference when you're in that horrible, horrible place. So yes, let's try an example of it. I want to give you one of the easiest exercises that we can do, which you can do anywhere you are, anywhere when you can take time to breathe. So if you're comfortable,
I am.
then I'm going to invite you to sit with your feet flat on the floor if you possibly can, and sit in kind of an alert posture. So try and keep your back straight, and you can either fix your gaze on a spot or you can close your eyes, whatever feels most comfortable.
May I close my eyes? Is that okay?
That's the way I feel most comfortable. So yes, feel free. And now just try and bring your attention to your breathing. I want you to observe your breathing as though you're a curious child who's never encountered breathing before. And just notice the air as it comes in through your nose and goes down to the bottom of your lungs. and notice it as it flows back out again. Notice the air moving in and out of your nose, how it's slightly warmer as it comes out and slightly cooler as it goes in. Notice the subtle rise and fall of your shoulders. And the gentle rise and fall of the rib cage. Notice the soothing rise and fall of your abdomen. And now fix your attention on just one of these areas, whichever you prefer. The breath moving in and out of the nose, rising and falling of the rib cage, or the shoulders, the abdomen. Keep your attention on this spot, noticing the movement in and out as the breath comes and goes. Whatever feelings, urges, or sensations arise, whether they're pleasant or unpleasant, just gently acknowledge them, just like you're nodding your head at people passing you by on the street. Gently acknowledge their presence and let them come and stay and go in their own good time. Keeping your attention on the breath, observing it with curiosity. Whatever thoughts, images, or memories arise, whether they're comfortable or uncomfortable, simply acknowledge them and allow them to be. Let them come and go as they please, and keep your attention on them. From time to time, your attention will wander. You get caught up in your thoughts. This is normal. Each time this happens, just notice what distracted you. Bring your attention back to the breath. No matter how often you drift off, whether 100 times or 1,000, your aim is simply to note what distracted you, refocus on your breath. Again and again and again, you will drift off into your thoughts. This is normal and natural and happens to everyone. Our minds naturally distract us from what we're doing. So each time you realize your attention has wandered, Gently acknowledge it, notice what distracted you, and return your attention to the breath. If frustration, boredom, anxiety, impatience, or other feelings arise, simply acknowledge them and maintain your focus on. No matter how often your attention wanders, gently acknowledge it, note what distracted you, and then refocus on. During this exercise, we've shone the spotlight of our attention on the breath. But the breath is happening inside a body, inside this room, inside a big wide world. So when you're ready, bring up the floodlights on the rest of your experience. Open your eyes and come back into the room.
Hello.
Hello.
I said at the top of this call I was worried I might cry, and I am tearing up. I don't know why.
Yeah. I think this is worth saying, actually. So one of the misconceptions about mindfulness is that it will always be relaxing or it will always be pleasant. And actually, it's not always. Sometimes when we're mindful, we'll become aware of thoughts that we might have been deliberately avoiding. We've all got different defense mechanisms that we use to get us through the day. And often that means that we ignore some of our thoughts completely, and we might not even be aware that we're having them. When we're mindful, we might suddenly be aware of stuff that's been bubbling away in the background for us. But what it does is it gives us control over how we react to those thoughts. Whereas when you're ignoring them, they might be, influencing you in ways you're not even aware of. When you're being mindful, you get to decide, do I allow that thought to dictate what I do next? Should I? Or should I refocus my attention and do something different? And it might be you become aware of something that actually your values as a person say, yes, I should be paying attention to this. Like one thing that I think would come up for me when I was pregnant and struggling with HG was the sheer exhaustion. I think I would have felt that hit me like a truck when I did mindfulness. But I needed to pay attention to that. So actually noticing, that's the thing that keeps coming into my mind every time I, need to refocus on my breath. I keep going there. I keep thinking about how exhausted I am. Well, that gives me a clue, doesn't it? When I finish the practice, maybe that's something I should take action on. It puts me in the driving seat, whereas I may not have noticed that before. So it's not necessarily.
So is that, Rosie, sorry to interrupt, is that why you encourage the person doing it to sit in an alert position as well, so that you're not being mindful doesn't turn into a little snooze?
Yes. So there are two ways of using mindfulness in pregnancy, I would say. So the type of mindfulness we just did there is about training your mind in a new skill. So it's helping your mind to learn to shift the attention about. So we have to be awake to do that, right? But as we've already talked about, people often really struggle in pregnancy, and especially in a HG pregnancy, with this really overactive threat system. And so for that reason, there are exercises which I would fully advocate, which are about getting into a deep state of relaxation. Something we haven't got time to talk about today, but I'm also a hypnobirthing teacher. And a big part of that is about getting your parasympathetic system to switch on and switch off that threat system. So I do fully advocate exercises like progressive muscle relaxation, maybe longer kind of body scan exercises, which might naturally send you drifting off into sleep. That's good too, for helping that threat system to calm down a bit and getting your body and your mind, therefore, into a state of kind of rest and repair, which we also need. But that is kind of a different thing. Mindfulness training is learning a new skill, so we do need to be awake for it.
So, Rosie, can I just ask some practical questions about what we've just done then? So let's say I'm suffering with HG and I want to try and put some of that mindfulness into my day. Obviously, you were talking me through it. So would I need to listen to that as a recording, or the words you're saying to me then, would I be needing to be saying them to myself?
Well, this is the great thing about mindfulness. So once you've done a few practices, you can start integrating it into any activity. It doesn't need to be a meditation. So I always start there, because when people are really in the depths of a problem, they're probably able to incorporate meditation into life, because, you know, certainly my experience of severe sickness, I wasn't doing very much. So I was able to do these big hour-long mindfulness meditations. And I do believe that's probably the easiest way to learn if you've never done it before. But the skill of mindfulness we can bring to anything we're doing. So these days, I don't have very much time in my life. I've got 3 children, all under the age of 5. So I'll be walking along, being mindful while I'm walking. It can be as simple as focusing your attention on the foot strike. So I might pick my right foot, for example. Just think, I'm really going to notice what it feels like every time my right foot hits the floor on this walk. Or I'm really going to notice the smell of the autumn leaves on this walk. And every time my mind wanders, I'm just going to gently refocus back to that thing. See how you could do that with anything. You could do it brushing your teeth. You could do it in the shower. You can do it, you know, making the baby's bottle. You just pick something, anything. It could be your breath, or it could be something outside of you. And it's the practice of, my mind is going to wander. That's going to happen. And every time it does, I'm just going to notice what it's wandered onto and pull it back to this thing that I've chosen. That is mindfulness. Doesn't need to be a meditation. It's just easier to learn it in a meditative state, and you'll start to enjoy it. Probably I really enjoy mindfulness meditation now, and I'm surprised to hear myself saying it, because when I first tried it, which must have been about 10 years ago, I thought, I'm never going to be able to do this, because, as you may have picked up, I have a very busy brain. I'm always doing stuff. I'm always thinking about things. I've got lots of ideas on the go at once. And my perception of mindfulness was that it was about clearing your mind. And I thought, well, if that's what we're aiming for, there is no chance I'm going to be able to do it. But it's not about that. You can't get it wrong. Mindfulness is just about the action of pulling your attention back to something, however many times it wanders. On a day like today, where I'm feeling super excited about this work that we're doing together, and about my mission with the pregnancy psychologist on Instagram, yeah, my brain is going to be all over the shop all the time. There's nothing wrong with that. My mindfulness practice is just as valuable today, when I know I'm going to be pulling my brain back a million times to whatever I'm focusing on, as it is on a day where I'm feeling kind of calm and zen, and I might only have to do it 4 or 5 times in the meditation. It's just as valuable, even on a day when you're finding it hard.
Something that was coming up for me when we were doing it was, it's been 5 years now since I've had HG. But the thought that just used to whirl constantly around my brain was, how is my baby going to be okay when I can't even drink water? And I feel like it was just like a record on repeat over and over and over again. And actually, I can see how trying that practice and allowing that thought to come in and saying, I'm now going to push that away, I can easily see how that could have been beneficial for me.
Yeah, so it's acknowledging that thought is there to serve a purpose. So your brain sent you that thought because your baby matters to you, and it wants to make sure that you've taken any action that can be taken to protect the baby. So first we listen to the thought and we think, okay, is there any action I need to take for this thought? Well, often with HG, you go to your doctor, you get some advice, and there's then nothing more you can do. There is nothing more you can do. So when that brain pops into your head, and I used to get exactly the same thought, it's about saying, okay, I see what that thought's about. Thank you for that thought, brain. But actually, I don't need to pay attention to it anymore. So I'm going to focus on my breath. And every time it comes up, this is one that works for me, doesn't work for everybody, but I would just go, thanks, brain, but I'm focusing on my breath now. And for me, I think it's important to have that kind of kind relationship with your brain and to recognize what it's trying to do for you here. It's not trying to screw you over. It's not trying to make you feel bad. Your brain is entirely devoted to keeping you and your baby physically safe. It's all it cares about in the whole wide world. So it's almost like I treat my brain a bit like an interfering auntie who cares about me but might give bad advice.
Okay.
Yeah, that's the way that I visualize it. So I just kind of think, okay, all right, thank you for that, but I'm going to go my own way now. Rather than, I think sometimes people can get angry with their brain. And I get that when you're having a horrible time with depression or anxiety or intrusive thoughts, it's really easy to go, oh, F off, brain, why are you doing this to me? But the fact is, it's much better to treat it like somebody who's got your best intentions at heart. They're just a bit misguided, annoying, but not evil. So that's why I like to sort of say, oh, thank you, brain. I get what you're doing. But I'm just going to focus on this other thing.
And Rosie, how long would it take you to become really good at this mindfulness practice?
Oh, this is the wonderful thing. So all of the research tells us that after a really short period of time, your brain gets better at this and starts to get the benefit from it. So I would say, stick it out for a week, do it every day for a week, and you will start to notice a difference. Stick it out for 6 months and you're going to feel a totally different person. I mean, genuinely, when I started practicing mindfulness regularly, I would start to notice all kinds of things in my life which had passed me by before. And to this day, I practice mindfulness every day now because that difference that it makes to my appreciation of the world, my kind of sense of gratitude for the life that I'm living, even when things are tough, I wouldn't give that up. I wouldn't give that up for anything. So yes, I would say the benefits start really quickly, but they just build and build and build. So you won't want to stop once you get started. It might not always feel easy, but it will still be worth it.
Brilliant. Rosie, this session's been amazing. I feel like I could talk to you about this all day. Maybe we can do another recording soon, but this has been amazing. Thank you so much. And before we end the call, could you please remind us where we can all find you online?
Yes. So please come and find me on my new Instagram account at the Pregnancy Psychologist. I'm filling that up with mindfulness exercises and helpful tips for mental health in pregnancy. And more people need to know about it. I only started it about 2 weeks ago. And so, yes, please come and follow me there. Or if you're looking for my website, I'm over at drrosie.co.uk, and I've got kind of long audios and blog posts that you can download for more help with your mental health during pregnancy over there.
Brilliant. Thank you so much for joining me, Rosie. It's been brilliant to speak to you today.
Thank you for having me.
If you or somebody you love is suffering, please visit www.pregnancysicknesssupport.org.uk.